Ba-bum, 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 ba-bum. Hello, ladies and gentlemen. This is the second episode of the Medic 101 podcast. And we're going to start live, we're going to start strong, we're going to start entering into a fun little topic. We're going to talk about doctors versus nurses. Ooh, what's going on? Who's going to win this battle? What's the difference between them? Who earns more money? Obviously, doctors. Which one's more fun and doesn't require not as much knowledge and, reading books? Probably nurses. Let's debunk this, figure it out. What sort of educations do you need? What sort of requirements in general does it take for a person to decide whether or not they want to be the doctor, they want to be the nurse, or they just don't want to be neither. They don't want to be neither, and they just want to live on with their life and think to themselves, well, hang on, medicine isn't for me. So, in case you weren't aware, right, bigger picture here. I'm Vincent Krishkov. This is Toilet Paper, and you're watching the Medi 101 podcast. Right, I don't know why I just did that toilet paper reference, but anyways, let's get started on what's the difference between doctors and nurses. What the flip are doctors? Right, let's do this. Pulled it out of the Big Oxford Dictionary. Doctors are what you'd stereotypically think they are, right? They're just trained medical professionals who know something about medical science, and they treat people who are sick or injured. Simple as that. And sometimes they don't even need to be sick or injured. They just want to have their body taken care of, right? Including holistically. And this could include your physician, your GP, pediatrician, etc. Right? A doctor is a lot of things. Even a surgeon. I know. Big news. Wow. A surgeon. But. Hang on a second. I've heard from this podcast a while ago, or from some other person, that they're junior doctors and senior doctors. What the hell are those? Right? Let's clarify that. Junior doctors are people who are being trained whilst they're working as a doctor. Right, they're still learning, right? They're still doing a bit of that reading, but they're also working in the NHS hospital. And we're making sure that they're getting their clinical skills ready, that they're ready for patient to doctor relationships, that they're ready for all of that drama before they're fully on their way to become independent senior doctors. And the thing with a junior doctor is, it really depends on how many years you get to be a junior doctor. Some are there for 5, 8 years even, depending on whatever degree you want to pick. You're always being looked after as a junior doctor. There's always a supervisor you can turn to, a manager. And that manager just so happens to be the supervision of a senior doctor, right? Or also known as consultant doctors, right? So they're typically a higher level than junior doctors in terms of their experience, their knowledge, their understanding of the whole hospital. And with a junior doctor, you usually tend to work with a few nurses alone, whereas a senior consultant doctor, they get to work with a whole team. They have a lot more responsibility on their shoulders, and that's why they're typically paid a flip ton more money, yeah? Money, yeah, we'll talk about that in a bit. The thing is, right, when you're admitted as a patient to a hospital, the name of the person you're given is going to always be a senior doctor. It'll always be a named consultant, right? Because you don't want to turn to the junior doctor for certain things. You want to turn to the senior doctor and put them under the responsibility of the care. So the junior doctor doesn't have as much responsibility. You know, you still deal with the patient's life and whatnot, but it's ultimately the senior doctor who supervises it all. And, you know, the blame falls also on them quite a lot for not telling their little student junior doctor, their little gremlin junior doctor, what they were meant to do to make sure that patient isn't dead, right? Let's be honest. So typically, right, junior doctors, they're not specialised, right? They can go into a specialisation, so they can do some GP training, they can do all sorts of different wards sometimes, junior doctors, right? They're able to have some of that flexibility, right? Some of that full town, flip town, you know? Get that free move, that dance moves, yeah, that moving like the waves. I don't know what I'm doing, right? I'm off my head. Senior doctors, not so much, but they're happy with what they're doing, right? They are experts in that field, and they're typically specialised or subspecialised. So, for example, I'm going to name it off the top of my head. I know of a paediatric cardiologist, right, who, before they become a senior doctor, right, before they became a consultant, after their 2 years of foundation training, they did an additional 8 years minimum. Like, they had to do 8 years minimum, plus doing a few exams that they had to pay for, and doing all sorts of different things to make sure that they get their postgraduate degree sorted, and those come out of your own pocket, right? Some of these medical exams postgraduate, they don't come out of the university's pocket, they come out of your pocket, right, if you want to become specialised. They're doing that alongside with a lot of work, right? On top of that, it took him 8 years to become a paediatric cardiologist, but mate is living well. He's living in a mansion, right? And he's got a pool and everything, which, you know, some of you viewers don't think that's very impressive, but I do, right? I want my own swimming pool. That's pretty fucking cool. Ooh, swear words. Anyways, let's be honest. How much do junior doctors earn, right? Well, since they're doing some training alongside, which I'll get to go into in a bit, they typically earn around 32,000 as a base salary, but that doesn't include accommodation. No. You know, that's pretty good, right? You can't exactly start a family off of 32,000. I mean, it's helpful. It's above the national average at the moment, but it's around 32,000 and upwards, right, for however long you're going to be a junior doctor. Whereas senior doctors, oh, they got crazy. Right, the average at the moment is £48,000 a year, something like that. I've rounded it up because I don't really care about the few £182 on top of that. They can earn up to 100,000 plus pounds, depending on their speciality. For example, if you're a really experienced anaesthetist or neurosurgeon, you're on around 108,000 a year, but there is a lot of responsibility on your shoulders. There's a lot of knowledge that needs to be gained, a lot of experience that has to happen before you can earn that amount of money. Like, you want to make sure that these people get that amount of money because of the effort and the work and the hours that they do. And talking of hours, let's talk about that. So, junior doctors, let's say around for a week, for the 7-day week, they can have 40 hours, right? And because they're junior doctors, they still need to do some training. So you get paid for 28 hours, usually clinical work, so that you'll be in a ward or you'll be in a theatre or somewhere else doing the clinical stuff. Oh, 1 second. It's tea break. Yeah, Yorkshire tea, milk, sweetener. Anyways, as I was saying, yeah, 28 hours clinical work, yeah, at the ward, yeah, at the hospital, you know, doing your stuff. and then you got that 12 hours where you get to go back home, or you get to go to your uni, and you get to look over the work. Let's say you're looking at a video on how to do a certain operation called an ileal conduit, which is quite useful stuff, right? These junior doctors still don't have all the knowledge they need to be fully independent, right? So they get to go back home or go somewhere else at a study centre and just look at the topics that they'll need to learn, and they just need to improve on, right? And you get paid for that, which is great, yeah? This is great. You just get to go home sometimes and chill, but it's usually a lecture room or something like that. And I'm not really sure about it, but you get to do studying for 12 hours usually, from the 40 hours you get to do. So just remember, 28 clinical, 12 educational. Stole that from the British Medical Association. Credit for them. And, senior doctors, they've already done their training, right? They don't need to do that. What they need to do is they need to do a lot more team management. They need to work a lot more with more patients and understand a case through and through. Who's going to work on it? What's going to happen? When are we going to get them off home as soon as possible so they can recover safely and doesn't cost the NHS as much money, or they can just leave the patient, hospital bed as early as possible? Because the thing with hospitals is they want to make sure that you're healthy enough so that you can basically F off and go to your home and probably take medications from there, because at the moment the NHS is a bit understaffed, I'd say, and there's not a lot of placements for all the patients. You don't get a lot of care, so senior doctors, they have to be cutthroat individuals. They need to understand who's going to go where, what's going to happen. They have to do a lot of work, and they typically work around 42 to 48 hours a week, so that's an additional 8 hours, but without the educational stuff. So, and they spend it all in their specialty ward or in the operating theatre with the patients and all of that etc. stuff, and they get paid a good amount of money because they do a lot more extra work on top of it, and you won't get to notice it as much because when you go back home you probably just sleep and go back to work anyways. That's how it is with doctors. You have to dedicate fully, especially senior doctors, and they both depend on the placements as well, your work hours. And with doctors and nurses, the different sort of shifts that you get to do, right? You have a day shift, early shift, late shift, night shift, split shift, long day shift. You got a rotational shift, you got on-call shift, a lot of shifts basically, because in the NHS you want to work 24/7. We want to make sure that patients can be taken care of when they need to be taken care of, right? You can't just sell to a cancer, oh sorry mate, we're actually closed on the weekends, like a bank, because you know how banks are really annoying and they always close at the most inconvenient times, right? It's not good. So what we tend to do is we just split the work week, making sure that you have something varied, something comfortable with you, right? And that can involve working from 10 p.m. to 6 a.m. or being at home and having the telephone next to you whilst you're watching your EastEnders or The Chase, and being able to pick up and say, oh, this patient needs me, yeah, I'll be on my way straight away. And you typically get paid a little extra per hour when you have on-call shifts. That's what they're called, on-call shifts. Is when you're not at the hospital, but you're still available to work at that hospital, and you typically get paid for that, even if you don't get to go to the hospital, because it can be quite stressful when you're watching The Chase, and on the last question you get that ring and you're like, God, is that Greg the neighbour who's got some extra shawarma he wants to give me, or is it a patient who's currently bleeding to death and they kind of need me? I don't know why there's fireworks. That's out of my control. But, yeah. He's not looking good, right? On-call shifts, you have to do those as a doctor. I mean, You want to make sure that everyone's taken care of. And senior doctors tend to have a lot of on-call shifts, especially if you're in the ER section or on the very much so intensive unit care section for nurses, which is, as it says, intensive care. And there is a maximum amount you can work, and that's 72 hours, but this really 72 hours a week, which is occasionally happens. I know, it's shocking. That's basically 3 days straight that a senior doctor can work at. It's pretty mad, let's be honest. It's pretty mad. Who wants to work that long? I don't know. You get paid a lot of money, yes, but you then come out as a shell of a person and get to just want to go home and cry and die yourself, basically. But no, that's what doctors are. Now let's move on to nurses. Let's do it. Cool. What are nurses? Yeah, this is quite an interesting question if you were living under a rock, for example. But yeah, nurses, they're also healthcare professionals like doctors, but they get to do a lot of that everyday care for a patient that's more direct. What they tend to do is take care of a patient holistically, right? And it's a lot of holistic care. And if you're wondering what holistic care is, that's a term that's thrown around a lot in medicine. So get your ears out and listen up, gentlemen and ladies and airplanes. Holistic care is taking care of an individual's needs, both physically, mentally, and spiritually and socially, right? Pretty bog standard stuff, because those 4 things affect how a patient's outcome comes out as, really, and it can affect the speed of their recovery, or it can affect whether or not they recover or not. So you get to really do that a lot as a nurse. Not so much the spiritual stuff, but yeah, there are certain nurses that are specialised for making sure a patient is happy, or they're not really sad, or they're just, not dying. So you might be asking to yourself, okay, that sounds cool and all, but how do they do it? What the hell do nurses do? Nurses, they tend to go to different individual patients and treat them through patient care, which, if you didn't know, that would just be administering medicine and making sure that they're eating food. Yum yum, that's good, because we all need to eat food, drink water, bathe them, clean them, make sure they've got new clothes on, and so on and so forth. And they get to also do medical procedures, which is quite bougie, right? Nurses get to have a lot of training to make sure that they can deliver a patient some IV solution that they need, or they need to take some blood safely and give it to a lab. Nurses are trained on doing certain medical procedures, which is really useful for a patient to survive. They also educate patients, right? Nurses, they get to tell you what that medication is. So if you're like a paranoid patient who's like, what's this? What did you just give me? A nurse can reassure that patient and just tell him, yeah, that's just painkiller, mate, bog standard stuff, because otherwise you feel a sudden in your stomach that's not really pleasant. So it's reassuring to know that a nurse is giving medication that they know what it is and how much they should give you, and talking to those patients and talking to those families and ensuring that they get the health, assuring them that they are getting the right health treatment and telling them about how it works and whatnot. It kind of gives a placebo effect, right, on how that treatment works, and can overall make a patient recover quicker. There's also certain assessments and monitorings that nurses get to do, right? They come to check in on you, make sure that you have a normal blood pressure, or that you're just not falling apart. Pretty self-explanatory. There's also a lot of things that nurses get to do. For example, the coordination of care, Anyways, forget about that butchered sentence. Let's start all over again. Coordination of care. That's something nurses do. What that means is, let's say I'm bleeding blood out my eyes. Not really good. And it's starting to bleed a lot more. Not really good. And I'm also vomiting blood. Blah, blah. And I'm a patient in the urgent care unit. And a nurse over there is like, oh God, that's bad. Let me treat whatever bleeding I can and get a doctor who's specialised into eye bleeding and mouth bleeding to come over and make sure we treat that patient, as accordingly. So it's pretty good. Another thing that nurses get to do is support and comfort a patient, which really is special. Quite a special thing in the medical world, where you get to go to that patient who's in a hospital bed and they're pretty bored and they just get to watch ITV all day, which is enough of a torture itself, let alone they're ill, which is also not good. And a nurse can come over and just say something like, hey, how are you doing? And they get to have these nice little quick chats that make a patient's day, and then it makes the nurse's day as well, and they're making sure that that patient is happy, right, and supported. And you get to have a lot of lonely experience in the hospital bed, and that nurse kind of becomes your friend for the next God knows how long time. And those nurses make sure that those patients feel cared for and they feel nurtured for, and the nurses also support the families who tend to go through hard times and struggles, over those patients, and the nurses are there to reassure those families that everything will be all right, or just to tell them that, hey, it's all right, these things happen, let's talk about it. And yeah, if you're really interested in the sounds of that and you want to know how to become a nurse, well, I've got the 3 cool ways in which you can become a nurse, because it's pretty flexible depending on person to person, right? If you're, for example, straight out of your GCSEs and you're pretty bored and you're like, I just want to start working, I'm 16 or I just want some dosh, you can start an apprenticeship through the NHS, or you want to do your A-levels as well and then do an apprenticeship at the NHS and do a nursing apprenticeship, which tends to start off quite well, 13,000 or even 18,000 a year for the first year, and you get to do a lot of the educational stuff with a lot of the practical stuff, which is quite cool, right? Apprenticeships, bush. Another way you can become a nurse is, if you're really into your reading or you're a nerd, is go through a university. So you have an undergraduate degree, which is 3 to 4 years long into nursing, and there's 4 different sectors of nursing you have to pick at your undergraduate degree, so you only do one of the 4, and it's either adult nursing, we have pediatric nursing, which is child nursing basically, we have learning disability nursing, and we also have mental health nursing. Cool, very cool. So you can do all sorts of these areas for fun and get to study about them and do a lot of another clinical work as well, and have some experience with that. And if you really wanted to, you can also do a postgraduate degree for 18 to 24 months, specialising in a certain type of nursing, so you can earn even a little more dosh. Pretty lovely. And the final way of becoming a nurse, other than lying and deceiving people with fake false papers, is taking a nursing associate program, which is funded by the government, from what I know, and you get a 2-year foundation degree, and you get to do all the sort of stuff specialised. It's between university and apprenticeship, where you get the best of both worlds, and honestly, it's one of the best options you can take if you want to get into nursing. Pretty lovely. So you might be asking to yourself, unless, if you have some sort of short-term memory, well, what's the difference now between the doctors and nurses? let's get into it. So I like to think of doctors as architects, all right, who sometimes become engineers as well into treating patients. For example, looking at the terrain, an architect has to decide whether or not, they can put the building there, build it, and making sure nothing collapses. And a doctor, well, they get to not only look at a patient's body and understand it, but they need to understand, okay, what sort of treatment will work on them, and how do I make sure that they're taken care of lovely and not experiencing any side effects. And it's diagnosing, okay? Doctors, they get to diagnose and they get to prescribe medications, procedures and treatments and get people involved, all right? They get to do a lot of the teamwork and sorting out of aspects of treatments and whatnot to that patient to make sure they're okay. And nurses, they get to carry out that treatment, right, and making sure that patient is fine, and they get to report back readings to the doctors, and these two really work together quite closely, and one relies on the other quite so well. Because imagine a doctor who's telling you, okay, take this IV bag every day, make sure that you also do an ileal conduit. I don't know, right? You can have surgery and whatnot, but without the delivery of medication or post-surgery treatment, that patient will still die. And nurses, they also rely on doctors, because what medications do I give to a person who's sneezing profusely and can't sleep at night? Right? I mean, yes, they'll get to learn about what medications they have to take, but do they know how to diagnose whether or not that sneezing and that not sleeping at night is involved with some sort of cancer in the brain? Who knows, right? So both depend on each other. It's pretty good. And nurses, what they get paid and how much they work. Nurses, they tend to get paid a lot less, right? They are stuck between 35 to 38 a year, 38,000 a year, which is still a good amount of money, but because of their work nature and their shift patterns, it's really a little amount of money compared to what some doctors earn, which is ridiculous. They get to do nearly the same amount of hours, and nurses, they don't feel quite so respected sometimes in terms of what they're paid. And it's doctors get paid, the average amount is around 45,000 to 42,000, which can get up to 100,000. And you don't really get that opportunity as a nurse, right? You're stuck really within the top limit of 40,000 or a tiny bit more than that. So you get to work between 36 to 40 hours a week if you're a nurse within the NHS, or you get to do whatever you want really as a private nurse. And doctors, they get to work a little more than nurses, but they don't have as much intense work environment. So it really depends on what you do, right? If you're a nurse and you want to do urgent care, you'll probably get 36 hours because it's a very stressed life. And if you're a doctor and you're doing GP stuff where you get to sit around all day and just judge people, diagnose and do whatever, you get to have 48 hours or however much you want. Whatever you want, whatever you pick, you got to decide to yourself, do I want to become a doctor? Do I want to become a nurse? Which one sounds more appealing to me, right? And you got to weigh everything, like the education, the costs of education, how long it takes, and really what's the salary like in the future, what job opportunities are in the future, and can I raise a family? It all depends on you individually. So if you really want to know what sort of career you want to get into, further down the line, nurse or doctor, I've got a really useful link provided from the NHS on terms of what careers you can look at. But now you know what a doctor and a nurse is, so you get to decide which one you want to be, because many people, they want to become doctors, but actually nursing is a lot more special. It's a lot more touching sometimes, and you get to grow up in like a little family of nurses, and it's pretty cool. I don't know how to describe it, but it's special, right? And you gotta look at all sorts of different things that they get to do and break down those stereotypes about nurses and whatnot. Anyways, I'm done yapping, right? I hope you enjoy the video. Smash a like. You know the difference between nurses and doctors. Hope you're happy with that. If you don't want to be neither, don't be neither. Why are you watching my channel if you don't want to be neither? We'll find out. And enjoy the rest of your day or night. Bye-bye. Hey, Vincent from the future here, just to say, if you have any content ideas or you want anything for me to improve on or anything just to say in general, feel free to contact me at my Instagram or just comment under the YouTube video. Sorry for bothering you. Take care.